Baptist Health Foundation is the philanthropic arm of Baptist Health System, and we exist to provide care and quality education, medical education services for patients and families and communities throughout Central Alabama.
The foundation is this hidden gem that just works behind the scenes. I don't know that everyone always realizes the different ways the foundation can touch the healthcare system.
We have the opportunity to be on the front lines of healthcare, and we can be nimble and react at the moment we know something is needed. As soon as we see an opportunity, we're able to jump in and fund it because we've had so many generous donors who've entrusted us to take care of those needs. Lucas devices, NICView cameras on all of our NICU beds, medical education for nursing students throughout the entire state. And then, of course, we always are incredibly invested as a faith-based foundation in the pastoral care and chaplain program throughout our hospitals.
Most women don't realize that cardiovascular disease actually kills more women than all cancers combined. So Erin's story is one that literally hit home for Shelby.
My name is Erin Murphy, and I am the charge nurse on the adult psychiatric unit here at Shelby. I've been nursing for almost 13 years. Very active, left to go to the gym, was training for a triathlon in June when my life changed. I was working, it was about noontime. I had just finished rounding on my patients, and I was in the hallway, and I remember feeling this burning sensation, like right over my left pectoral area. And I thought, that's weird, okay. Nothing was out of the ordinary. I had just turned 44 the day before. And so then I started to have left arm pain. And I thought, that's not good. That's a cardiac symptom. So I sat down, I had a friend take my vital signs, and they were fine. As a woman, you're like, this is nothing. Like, this isn't a big deal. Let me not make a big deal and overreact. But it didn't go away. I started to have more chest pain. I was short of breath. So I walked to my nurse manager's office. She called a rapid response on me. They whisked me through the hospital and brought me downstairs to the emergency department. Cardiology came in to consult. And he goes, I want to keep you overnight. I want to put you in ICU. And that's when it got real. I started crying. I was terrified. All I could think of was my 4-year-old.
She had a rare form of a heart attack, something called a spontaneous coronary artery dissection, or SCAD. You know, a typical heart attack, you'll see a blockage from cholesterol, from a blood clot, that sort of thing. In this case, she had a sort of separation of the lining of the vessel. And so that's how we figured out what was going on and were able to get her the care that she needed. First off, they're extremely rare. When we do see them, it, by and large, tends to be young, otherwise healthy women.
I mean, I knew what a SCAD was, but it doesn't happen to people like me. It's actually the #1 reason of heart attack in women under 50. I said, you know what, people need to know about this. We don't fit the typical cardiac profile of a cardiac patient. We just don't, you know? And so educating people on what the symptoms are, and really to listen to your body and not get into that mindset of, I don't want to be embarrassed, I don't want to call an ambulance, I don't want to draw attention to myself. That's a very common human experience, but you could be doing it to the detriment of your health. When you're running your household and you're managing your kids and you're doing all the things and you're working, we take care of ourselves last often, even unintentionally.
I think especially as women, we are so focused outward and so focused on helping other people. I'm just glad she was around the right people who could get her seen and we could get this figured out in time and get her the right care.
We watched our team take care of her, and we watched her progress through the course of her treatment, and so excited that she gets to touch the lives of patients and visitors who come here to Shelby.
Each year, Baptist Health Foundation provides over $2 million for health care in our community, inside our hospitals and outside the walls. And without your help, we can't be there to do those things. The impact that we raise with the dollars here tonight are going to save women's lives.